I have been trying to call her for 45 minutes. I've paged her 3 times. I have not gotten any answers. She's always late.
Well, her patient's waiting.
I know. She already had one patient that left because they were so upset for not being seen. Another was seen by another resident in her clinic, and I know that patient's been here for at least 20 minutes. I don't know what else to do. This is the problem. She's always late.
Yeah, I think you're right. Well, I'll go let the patient know that, we think she's on her way. Just let me know, okay?
I'll keep trying.
All right, thanks.
Dr. Finker, I'm so sorry. Traffic was so bad and we had so many sick patients in the wards. And I had to do an LP and, and I got it on my 3rd try, but, so I just need to check the CSF results real quick and then...
Your patient's waiting.
Okay, but I just need to check really, really quickly.
You've been late to clinic a lot.
Oh yeah, I know, I'm sorry. It's been so busy with flu season and everything. Oh my gosh, 1,300? She totally has meningitis.
Your patient's waiting. I mean, it's time you need to go see her.
Okay, all right. I'll go see that patient and then I will call and check in on this one. Okay. So, let me see. Don't have my glasses. Do you know who my first patient is?
I think it's a well child check.
Well child check?
2-year-old.
Okay. Oh, so I think I left my stethoscope down at the other ward. May I borrow yours?
Yeah. There you go.
Okay. Thank you.
What am I supposed to do with this? So unprofessional, always late. I don't even know what to do.
What? She says I'm always late? That's not true. I was only late just a couple of times, and that was because I was doing really important stuff. Unprofessional. Don't take interest in my patients. Of course I'm interested in my patients. Not dedicated, need to learn to manage clinic patients. What is so hard about a child that's not even sick? Oh, gee.
Come in.
Hi, Kara. How are you?
Good.
Good. I'm Diane. I'll be your nurse today.
Hi.
Hello.
Yeah, she's feeling a lot better, which is great. Do you know when the doctors are coming back? Because you haven't heard any results from the test or...
Yeah, sometime this morning. I heard it's Dr. Welby. He's one of
Dr.
our
Welby?
one of our best neurologists. Kara, you're gonna love him. He's
Yeah.
been here for a long time. He's great.
He's really experienced.
He's the most experienced neurologist we have.
Wow. Okay.
Yeah,
That's good. Okay. All right. So you think this morning?
Sometime this morning.
Okay.
Yeah, they usually make rounds in the morning. So, yep. Nice to meet you guys. Okay, do you have any other questions?
No.
Okay. We'll see you guys later. Bye-bye. Bye, Kara.
Come in.
Hey, Kira, how are you?
Good.
I have a granddaughter named Kira, and she's not as pretty as you, but almost. How are you? Dr. Welby, how are you?
So nice to meet you.
Well, I'm the neurologist, so they asked to come and see your daughter. The problem is that fortunately she doesn't have a brain tumor, but these spells we have to treat, and the medication she's on is not as good as the one I want to put her on. So I'm switching her to something called Keppra. And frankly, I don't know how to put it into the computer system, so I've asked our resident to come here and help me do that.
I'm so support we put the order
Oh,
really quick.
Okay, but we're going to
Talking
start
really
that
fast.
med today.
We're starting that med today, but the problem is,
Yeah.
because we're starting a brand new medication, we have to keep her in the hospital for at least 2 more days just to watch for potential side effects and allergies. As a rule, they don't occur, but it's better to be safe than sorry.
Okay, sweet. We can't go home. I'm sorry.
Is it okay, Kara? You're gonna have to stay, okay?
We'll watch some movies.
Okay.
Okay.
Any
They're not
que-
going home today?
No, they're not going home
Oh,
today.
okay.
Okay.
So do you have any questions?
No, thank you. So the new medication today, and then we'll just watch her.
Watch her for a couple days, and then
Okay.
I'll see her in the office in about 3 weeks.
Okay.
And just so you know, I'm not going to be able to put my note in today as I go to clinic, so it might be later this evening.
Well, please get it in, because otherwise my boss is gonna be very upset.
Yeah, okay.
Okay.
Thank you.
Yeah.
Well,
Bye.
Well, thank you.
Bye.
Thank you, Dr. Welby. I
Thank you.
appreciate it.
Good to meet you.
Sorry.
Hi.
Are you Kira? Kira. Hi, my name's Marianne. I'm the pharmacist.
Oh, hey. Hello.
Nice to meet you. I'm here to talk to you guys about you're getting Tegretol.
Great.
That's the medication that we recommend. She's on the perfect med, but we just need to adjust the dose for her weight.
Her dose?
Well,
Dr. Welby, the neurologist, was in here and he said she should be on a different medication. Did you talk to him?
Dr. Welby? I'm not sure if I know him.
Dr. Welby? He's like the neurologist here?
Okay. I've only been here 5 years. Maybe I don't know of him, but I will go and take a look and see if I can find out who he is and what med he's talking about.
Okay. All right. Come in.
Bringing in a lot of people here. Hi Kira, how are you? Good. Mrs. Wagner. I'm Charlene Murphy. I'm the senior resident on the team. We spoke earlier.
Right.
As I promised, I brought in the full team. This is Dr. Austin. He's the attending physician.
Nice to meet you.
This is Dr. Crossan. She's the intern.
Right.
And we have a couple medical students. This is Ben and Rachel.
Okay.
So the plan is that we are going to sort of talk about Kira, discuss the plan, and then answer any of your questions that you may have.
Okay, that sounds good. I'm just a little confused this morning, so but I'll let you guys talk, so go ahead.
Okay, so Kira is our 8-year-old female who was admitted last night with increasing frequency of spells that are concerning for possible seizure. So in summary, our plan for today is that we think Kira is ready to go home. It seems like the dosages we have right now for her medications are working really well, so I'm happy to either fax those prescriptions or give you a written prescription if you want to fill those at our pharmacy before you go.
What are you talking about? You guys call yourself a team? I can't get the same story from any two people who come into this room and talk about my daughter.
Oh, I'm so sorry. I didn't realize that was happening.
We have to get this straight.
Hi Hank, hey, it's great to see you.
Hi, Jenny.
Hi, great to see you. Hey, look at our first patient is just checking in. Now I know it's your first day of the rotation, so I want to go over some things that we're going to be doing today.
Sounds
Okay?
good.
All right, so let's go in here. This first patient should be interesting, has some classic features. Most of the residents find that they can see really good by sitting there. You know, I find it really fascinating to watch these kids demonstrate kind of subtle classic features. It's really interesting. I think you're going to find it useful, but remember the walls are really paper thin, so you have to try and be as quiet as possible. Oops, I'm getting paged. They must be ready. I'll see you in a jiff.
Oh, okay. This is great. I don't know anything about this patient. I guess I'll just watch and relax.
Okay. Because if they will, I'll probably try to send this to them.
What time is? This is boring. I don't know anything to look for. I don't know anything about this patient. This is not going to be any use to me in my career in the PICU.
So Hank, are you ready to talk about this? Did you notice all the repetitive, stereotypic movements that the child was demonstrating? He has a lot of classic features of autism. Did you notice how Mom was beginning to describe his speech at the beginning? I was just so glad that this was your very first patient of the rotation. This is so exciting. So, well, what do you think?
It was good. I saw some stuff and yeah, it was good.